and welcome to the Geula Mamas show. This is your place for everything pregnancy, birth, and babies with emunah and a whole lot of love. I am Tivi Goodman. I am a home birth midwife, mommy to 6, and safta, and I am so excited to be joined today by Sara Maimon. Hi, Sara.
Hi, great to be here with you.
So exciting. Sara has been a nurse for 19 years. She worked in women's health for over a decade in the United States and in well baby care since making Aliyah 7 years ago. Where did you make Aliyah from?
From New York. I lived most of my life in the various communities in the New York area. I lived in Muncie, in Brooklyn, Flatbush, and yes.
I lived in Muncie. I lived in Brooklyn for a little while. Lived in Florida, lived in California, all over America. So I'm sure we passed by each other in the streets.
Probably, yeah.
So Sara, this is so exciting because we're going to talk about vaccines, which is like the most hot topic and the most mommy shaming, and especially with the measles outbreak right now in Israel going on, everybody wants to know about vaccines. And what we're going to do for our listeners is we're not going to tell you what to do. We're going to remind you that we're never going to shame another mama on her decisions, but we're going to give you some information. Sara's this is what she does all day. So she's going to teach us about the different vaccines. We'll talk about what she recommends. We'll talk about what I do, what other people do, and then we'll just present you with the information so that you can help make your decision for your children in the best way that you can, and we honor you for your decisions. So, Sara, first of all, where are you working today? In Yerushalayim, you said?
I work in Tipat Chalav, which is the well baby clinic of the health ministry, the Israel Health Ministry. It's completely, if all services offered are completely free, funded by the health ministry. In Jerusalem, it's managed by Jerusalem City Hall. We do well baby exams and administer vaccines. If we suspect any problems, then we refer the baby back to their regular doctor.
Okay. And that's known as Tipat Chalav. That's
known as Tipat Chalav, a drop of milk from in the decades and decades and decades ago when they used to think it was healthy to give out formula, and so the baby clinics would give out formula. The name still stuck.
That's how they got the name. I always wondered about that.
Yeah.
Because when I think of Tipat Chalav, I think of mother's milk. So I never even associated.
Right, of course. It's actually, I think it's a system that began, I think, in France, or I don't remember what country, and it was adapted in Israel. But now, no, we don't give out any formula anymore. So you can be rest assured about that.
That's great. Wow. So I would love to hear, first of all, how did you get involved in what you're doing? I mean, obviously, you didn't do the exact same thing in America because it doesn't exist. So what's your journey into sort of what you did in America, what you do here? Is this something you always dreamed of doing since you were young? How did you start this?
Well, actually, I started on my nursing road, actually, towards midwifery, but I guess you could say I got sidetracked along the side in doing other things. I was in women's health for quite a number of years, as you mentioned, and for most of my career in the U.S. And then when I came to Israel, I had my first 2 children were born in Israel, and I was in a different stage of life all of a sudden, and it seems that coincidentally I just saw an advertisement for Tipat Chalav and I applied for it. But really, whether it's coincidental or not, it just happened at the same time that I was a new mother myself. So my work informed me at home, and my experience at home informed me at work.
Wow, that's so nice that the two work together.
Yes.
Wow. All right, so let's just begin, I guess. Talk to us. Tell us about vaccinations. What do we need to know?
Okay. Well, mostly everybody really knows what vaccinations are. well, not exactly. They know, most people know that vaccinations are a form of the disease itself. Some are completely killed, but have some identifying proteins related to the disease, and some are slightly alive, but they're much less strong than the disease itself. And the point is to trick your immune system to think that you're getting the disease, and so that next time that you're exposed to the real disease, your immune system already knows how to handle it. So I think most people understand that that's the basic idea behind vaccines, and I think that very few people would dispute that vaccines are very effective in preventing diseases. The problem is that many people are concerned that vaccines have all kinds of other dangerous effects. And I think that's the primary reason why people hesitate to vaccinate, even though most people will agree that they're very effective in preventing the said diseases.
I think that people say sometimes, yes, the vaccine is good for everyone, for the general populace, but that doesn't mean I should give it to my child. Again, that might be correct or incorrect, but that's maybe what people are saying.
Okay, there's something called herd immunity. And herd immunity means that if a large enough percentage of the population is vaccinated, if I don't vaccinate, I probably won't get that disease because I have nobody to catch it from. So that's true. So that there's something true about that. If all the people around you are vaccinating and you choose not to vaccinate, you'll most likely be okay because you're riding on the backs of everyone else. But if you're going to do that, you might, instead of trying to proselytize to other people and tell them vaccines are bad, don't vaccinate, you're really acting against your own best self-interest, because if you're not vaccinated, you need them to be vaccinated all the more.
So if you really want to be smart, you should encourage everyone else to vaccinate and then quietly don't vaccinate.
If you're not going to vaccinate, yes, you really should be quiet about it for your own self-interest. Yes.
Okay.
The less people vaccinate, the more people you convince not to vaccinate, then the more likely you have of getting that disease.
Right. So unless someone's okay with the disease, like I personally, I'm okay with chickenpox. So I was not a big fan of that disease, but I'm not okay with, measles or something perhaps. So
exactly. If you're not particularly concerned about a particular disease, then you wouldn't be concerned about trying to convince other people that it's not a good idea as well.
Now, polio, when I was a little girl, like my husband's a bit older than me, he got a polio vaccine. I didn't, because from what I understand, at some point, certain diseases can be completely eradicated and you don't need to do that anymore. Is that, would that have to be a worldwide thing then? Because people travel, right?
It has to be a worldwide thing. One of the diseases that was successfully eradicated was smallpox. And so that's correct. Now we don't give a smallpox vaccine anymore, and smallpox is only carried in very, very supervised condition in laboratories. So yeah, polio was almost eradicated, but it has not been eradicated yet, and there have been some outbreaks, mostly in a developing world with poor infrastructure, like in Africa. I believe possibly maybe there was in Syria because of the war, but polio has not been completely eradicated just yet.
So it's possible that they may begin doing the vaccine again.
Okay, yeah. So now, since polio was thought to be nearly eradicated, everyone has been getting a dead polio vaccine. The live polio vaccine was added in Israel a few years ago. It was returned. It had been taken off the list, and it was put back on the list in Israel because polio virus was discovered in the sanitation. So it was realized that some people were shedding the polio virus.
So when it's
this is a little bit complicated. I don't know how much detail the listeners want me to go into. What is the difference between the dead polio vaccine and the live polio vaccine? But basically, the dead polio vaccine.
Polio, or is it the difference between any dead form or live form of any vaccine?
No, it's just polio. That's another thing that people think when people say vaccines. They talk about vaccines as if all vaccines are the same thing, but each different vaccine has different properties. The fact that they run by the general the general principle of tricking the immune system, that they have in common. But beyond that, each one is so different. So it's very hard to make a blanket statement about all vaccines.
Okay, so the live polio for the past few years is being given in Israel.
It's being given in Israel, yes.
Okay, so yes, could you tell us about what that means?
Okay, so as I said, I'm not sure in how much detail the listeners want me to go into. The dead polio vaccine is mixed together in part of what we call the mechumash. It's mixed together with the tetanus, diphtheria. It's mixed all together. One of the things that includes, one of the 5 things that it includes is polio, completely dead polio, absolutely no risk of transmitting polio in any way whatsoever in the disease. It's not live at all. But that, for whatever reason, and this is something I don't actually understand down to the last detail myself, for whatever reason, it doesn't protect the whole body. It doesn't protect the digestive system. It protects the bloodstream and it protects the nervous system. So the polio can still dwell in the digestive system, and maximum the person who has it will just have a little bit of diarrhea. They won't even know they have polio because they won't get the major effects of the disease, which when it travels through the bloodstream and hits the nervous system. That's why the drops go to the digestive system and kill the polio, prevent the polio from growing in the digestive system altogether.
Now, this is the dead form of the disease?
Right. The drops have a greater coverage in the body. The live vaccine, the live vaccine covers the whole body, including the digestive system. Whereas the dead vaccine allows the virus to grow and the illness to grow in the digestive system. Then the person gets a couple of diarrhea and it passes and they live happily ever after and they don't even know they had polio.
But that's not what's being given anymore anyways.
Both are being given. Both are being given.
Okay.
Both are being given because when they found the polio in the sewage, they check. The Bisrad al-Tavru'a, it's called, the sanitation ministry, checks the sewage to see if there are diseases growing, and they found wild polio. So they saw that people who had been vaccinated with the dead polio were still being sick with polio, but only in their digestive system. They weren't getting the paralysis. They weren't getting those really scary, horrible diseases, but they were spreading the disease. So the Ministry of Health, and according to the World Health Organization's guidance, said, let's bring back the live polio, because in order to prevent, so we shouldn't get to a case that one of these people who's got the polio diarrhea should pass it to an unvaccinated person or an immunocompromised person.
And then they would get the full, like if a little baby who hasn't been vaccinated would get the full polio. And then they start spreading that.
Yes, exactly. Now, why do they do both? So why don't they just do the live polio and not the dead polio? Because a live vaccine is not completely dead, so there's a teeny, teeny, tiny, less than 1 in a million chance, but a chance that still exists that it could turn into the disease itself.
Mm-hmm.
So they give 2 doses of the dead polio and then only give the live polio to the baby after that.
Oh, so they've already been prevented from getting the disease.
Exactly.
Okay, I for sure did not know that.
Yeah, it's a little bit complicated, and I don't know how much people are interested in this. I think they're more interested in what are the side effects that I can expect for my kid. So maybe we should talk a little bit more about that. What do you say?
I think you're right about that, but this was important information to know.
Yes.
And since they only started doing this a couple years ago, what happens to, like, my youngest child is 9. So she probably wasn't vaccinated. So we're relying on the babies now that are vaccinated in this way. Like, how does that work? They're not calling everybody in, like myself, to become revaccinated with the live polio. Like,
okay, I think I'm not sure how old you are. I was born in the 70s. I think in the 70s and 80s we all got the live polio vaccine.
not the shot that used to leave a
We
mark.
all got the live one in the 70s and 80s. So adults have got one. And I think even before this polio scare, the Ministry of Health was giving one additional live polio vaccine, but that was before I made Aliyah, and I'm not sure how the system works.
Okay.
So at some point,
is America doing the same thing as Israel? Do you know?
At the time when I left America, they were not doing it, but I haven't kept updated if they're offering it now or not.
Okay. But you did mention that the World Health Organization is recommending this, so they may or may not.
They recommend it in areas where polio has been discovered.
Okay.
Yes.
So if somebody makes Aliyah or someone's visiting Israel with young children, they might need to look into this then.
If someone is, at the current time, there's no outbreak of polio. So I wouldn't be too nervous about it. I wouldn't worry about it. The Ministry of Health made the decision to start everybody from a certain age. And I think it's just, instead of calling the whole country.
Mm-hmm.
I wouldn't worry about it unless there's another outbreak. I don't think they should be concerned.
Also here in Israel, as opposed to America, they give vaccinations in school. And you can refuse them, but all the first graders, all the third graders, whatever it is, the nurse comes to school, they vaccinate. So if they needed to do that, they would do it then. And I mean, they give the papers, information. You don't have to accept it, but they could fill it in that way though. Okay.
Yes.
So maybe we should start now from, I guess, newborn. A baby is born into the world, day one, going forth. What do vaccinations look like?
Okay, so let me start out with the hepatitis B, which is the first vaccine that maybe your listeners want to know about, because many of them are pregnant and they want to know if they should give the hepatitis B vaccine at birth. Okay, so hepatitis B is it's a blood-borne disease. It's mostly transferred via bloodstream or via sexual secretions. It's a sexually transmitted disease. So lots of people say, I don't want to bother giving my kid the hepatitis B vaccine because my kid is at low risk. And that happens to be true. That happens to be true if none of the close contacts of the baby have hepatitis B, and the baby is at low risk for getting it. It's not impossible though. Well, first of all, a lot of people don't know. They haven't been tested. They don't know if they're if they have hepatitis B or not. So that's one thing. And it can live, hepatitis B, it doesn't have to be, you don't have to stick a needle into someone for a blood transfer, because it can live on surfaces. It's a very strong virus that it can live. Some blood wiped on the desk and it can live, or on an unsanitized medical instrument, and it can live on that thing for quite some time, for days, until it gets to somebody else.
I did not know.
Right. So the chances of a child who does not have a close contact who is hepatitis B carrier, the chances of them getting them catching the disease are quite low. I also, as a healthcare provider, I was vaccinated, so I know I didn't have the disease. I knew I wasn't a carrier, having been vaccinated myself. So actually, when my kids were born, I didn't give them that disease. I didn't give them that vaccine. Not because I thought it was dangerous, but because why put them through one extra injection? But not long ago, actually, my son was at the barber and he got nicked by the barber. I don't supervise the barber's sanitary instruments, so I'm like, you know what? Let me take him in. And I took him in the next morning and I gave him the vaccine.
In America, I know that they did not, at least used to, vaccinate for Hep B, because when I went to Jamaica with the midwifery program, we all had to be vaccinated. And then when I made Aliyah, the whole family had to be vaccinated for hepatitis B.
I think it's about 20 years old or so, maybe a little less, the hepatitis B vaccine.
Mm-hmm.
I didn't get it as a child either. I got it as a health provider. I took the needle and stuck it into my leg myself.
Wow. Bravely.
As a healthcare worker, it's very important because we do come into contact with all kinds of people's blood, and so it is, you know, I would say for a healthcare provider, not optional, do it. But
Right.
yeah.
Right. So what are the potential side effects of giving it to, you're saying a newborn baby? This is the first
Right.
vaccine you give.
Okay. So hepatitis B rarely causes any side effects at all. It rarely causes any side effects at all. There is some research going on as to whether it's associated with autoimmune problems later in life. One of the primary researchers on this is actually an Israeli, Yehuda Schoenfeld. At the current time, his theory is not accepted by the wider medical community. It's thought to be very, very, very vague. The connections that he's making are thought to be very, very vague, such as lumping any type of autoimmune disorder that appears at any time during the life into one kind of effect. So that's thought to be very vague and not rigorous enough to scientifically evaluate. And it's not accepted currently by the medical community. The CDC, the United States, has specifically stated that, at their opinion, there is absolutely no connection. I think some French scientists have offering a minority view that there is some connection, but at the current time, it remains, I think, a very remote suspicion.
I have a feeling that most people who are anti-vaxxers, I think it's called, also really don't care what the medical community says, because of all the times that the medical community says things, and they're silly. They're sometimes really bad for you and dangerous, because it takes a certain amount of research, and it takes a certain amount, grant money comes from, big pharma, and there's so much involved with that. So I'm wondering if you can talk about your experience. What have you seen in your years?
So that's definitely 100% correct. Recommendations change. Recommendations change all the time. Things that we thought that were 100% safe are later discovered not to be 100% safe. Things that are thought to be helpful are later found to have thought not to have been helpful at all. So it's true that recommendations do change. And what I'm saying, at the current time, there isn't any rigorously studied information that proves the connection between hepatitis B and autoimmune disorders. Will something come up eventually in the future? I cannot rule that out.
Well, I think also because, Hashem lets down into the world the knowledge that we have at the time. And you could live your life saying, oh, if I knew now, if I knew then what I knew now. But part of our ishtadlut is to do what we can with the information we have today. If that's the best information we have, that's what we have, right?
Yeah, that's the way I look at it too. That's the way I look at it too. The best information we have now is that the hepatitis B is one of the safest vaccines out there. And can I guarantee you that no information will be proven in the future? I can't guarantee you that. So It's really up to you to make that decision.
Right. But according to what you've learned and according to what you've seen, it sounds like you just have not seen side effects. But then again, you're vaccinated, and you know more or less the people in your family, and you made that decision with your own children.
Yeah, and then when my son got nicked, I went and I got him vaccinated.
Right. Okay, great. What's the next vaccine that a baby would have?
So at age 2 months on the schedule is something I mentioned already called the mechumash.
Okay, so just 1 minute. In the hospital, going back, the only vaccination a baby gets in the hospital is the hepatitis B.
Right. There are other treatments that babies get in the hospital, but they don't fall into the category of vaccines. So I don't know if you want to talk about them here or not. Eye ointment, vitamin K, those aren't vaccines, but yeah. So I'm
So
not sure if you want to talk about them here.
let's run over them quickly because people might think they're all vaccines. And like I've had my babies at home, but I did take them to Tipat Khalaf to have some of those tests done. And the eye ointment is kind of a half and half. It's not a test, it's not a vaccine. So let's run over those quickly.
Okay. So the eye ointment is to prevent. You got to help me with this one.
Gonorrhea, right? Is it gonorrhea?
Yeah. Yes. It's one of these sexually transmitted infections that can cause blindness. Now, from the Ministry of Health's perspective, if we go around asking everybody, do you have a sexually transmitted disease and would you like us to prevent your child from getting this disease, then everyone will say no and no one will get the thing and some kids will come out blind.
Okay.
So we give them to everybody. Even testing everybody, it's not routine testing for sexually transmitted disease is not done during Israel during pregnancy as it is in the US. But even if we were to test everybody, it's likely that we would either miss some cases or some people wouldn't know their results and wouldn't bring their results with them. So they just give it to everybody.
And some people are going to be fine until the day beforehand, and
yes,
because of their actions. So definitely, as a government, that is a good decision to just put the eye ointment. Is there any side effects to the eye ointment for the baby?
That I'm not up to date on. I'm not up to date.
As far as I know, they can't see so clearly. It could affect the mother-child bonding in whatever small amount because your baby, can't see well.
Yes.
Right. I mean, they already can't see clearly because they're newborn babies, but even less clearly. Right.
Yes.
So I personally did not use the eye ointment, Baruch Hashem, for my own personal situation. But then again, I was having my babies at home. So that's a personal situation, but that's very important to know what that is. Then the PKU, the vitamin K, right? What else is going on in the hospital?
Right. So the vitamin K is to prevent. The vitamin K is for clotting. To help the blood clot. We make vitamin K with our liver, but sometimes babies don't make a lot of vitamin K enough vitamin K until they're about 3 months old. It's very, very, very rare that a baby should. Well, there are certain cases where babies are more likely to have bleeds, like prematurity, and so forth, in which a vitamin K could be really essential. But in routine healthy babies, it's very rare to have a bleeding condition, but it's to prevent these very rare conditions, yes.
If a baby's born via forceps or vacuum extractor, they should have the vitamin K.
Yes.
Or any significant trauma.
And then I think as Jews, most of us are going to be circumcising our babies, so I also think a vitamin K is a good idea.
So actually the baby's natural immune system, the vitamin K in a baby is at its height on the 8th day, which not everybody knows that.
That's amazing.
That's very amazing.
No. That's amazing. It's fantastic. Wow. That blows my mind. Look at that.
The vitamin K levels in the baby actually rise up until the 8th day, and I think a couple days later they start to lower again. So if you know that your own baby had a natural birth, they don't have bruising on them, it was a gentle birth, and you're going to be circumcising on the 8th day, from what I understand, even if the baby might be circumcised 2 weeks later, it might be worth giving the vitamin K because their levels have lowered and they haven't hit that 2-3 month mark that you mentioned. But on the 8th day, this is what I learned. I mean, it could be wrong, but this is what I understand, that their vitamin K levels are high. And again, I did not give the vitamin K for that reason.
I did. Yeah, I had both of my kids get the vitamin K because even though it's extremely rare to have a complication, I feel like that the benefits outweigh the risks. I'm not familiar with any risks of vitamin K.
The only risk I've ever heard of is they can be jaundice, perhaps because their body has to process the extra bilirubin, whatever it is, through their system, which is, it's not really a big deal. And you're right, it prevents any, internal hemorrhaging or bleeding that you might not know about. So it's definitely something to think about either way.
Yes.
And then the only other testing in the hospital is the PKU, or am I missing something?
Well, they do. I think they do bilirubin testing. They do a blood count, and they do what's called the PKU, as you said, which is a test for various, also very rare metabolic diseases, but diseases that, if they're caught early, can be treated.
Right.
So it's painful for the baby. The babies cry. It's hard. I do PKUs at Tipat Chalav, actually. I do them for women who have had home births or for women who have had early discharge from the hospital and have not stayed long enough to get the PKU. So I do them, and the babies cry. They do. It's painful and unpleasant.
You poke their foot, but like a little bit of a larger, like a slit, and you have to squeeze out some blood. So
yes.
But as you said, if that baby has this particular thing, I think it's simply a dietary change, and they can grow up completely healthy, normal.
Yeah, they add more and more, and I think there's about 12 diseases on the list.
Mm-hmm.
So one of them is what you're talking about is the PKU, which is a dietary change. There are others also that have to do with dietary changes, and there's a thyroid disorder that they test for, which can be treated with thyroid medications, so before any damage is caused. So I really think, even though these diseases are rare, I mean, and the baby goes through pain, and it's really, it hurts to watch them, but it's so worth it, because so much damage can be prevented if something is discovered.
Right. I absolutely agree with that, because there's no side effect. The only thing, it's just a test. Your baby's going to cry for a few minutes. They're not going to remember it, and you can give them a healthy life. So no downside there. Very quickly, you mentioned a general blood count. Again, that's just a little poke, just checking, right? Checking their blood levels. Yes. And the bilirubin is checking the bilirubin. You're not giving them anything. You just
blood typing. Blood typing. Yes, okay. Blood typing.
Blood typing. So those are just
They're all done at the same time. Yes, it's a small amount. Yes.
Okay, great. So now they've had one vaccine, possibly the eye ointment, a couple of tests, and now we have babies 2 months old, right?
Okay. Oh, I forgot to mention the hepatitis B is a series of 3. It's a series of 3 injections. So the second injection is 1 month after birth, 1 month after the first injection.
Okay, so we're bringing the baby in anyways, usually to be checked at Tipat Halav. At 1 month, they're getting the second round of Hep B. Okay, so now 2 months of age, what happened?
Okay, so 2 months is the 2 months is well, the first thing that's given is what's called the mechumash. I mentioned it before because one of the 5 things it contains is polio. It contains tetanus, diphtheria, pertussis, what else? Polio, as I said, and something called Haemophilus influenza. All these vaccines are completely mumatim legamre. They're completely dead, and some of them don't even contain a whole virus particle, just proteins extracted from the virus.
So this is what used to be called the DPT, when I guess it had 3.
Yeah. Okay. And now it had 2 added to it.
Mm-hmm.
Then there's another injection, separate injection. It's called the pneumococcal vaccine, which is a type of strep organism that can cause pneumonias, throat, ears, in rare circumstances, brain. The brain can be affected from this organism as well. I believe it's treatable by antibiotics, but there's also many resistance, lots of resistant organisms, and it's extremely common. It's thought to be dangerous to children under 5. Us adults are not thought to be at danger of complications from the disease. Mm-hmm. And then the last but not least is called the rotavirus. The rotavirus is a live vaccine against the rotavirus, which is a virus that attacks the intestines.
Okay. So these are 3 injections that the baby gets at 2 months of age.
Oral drops, 1 set of oral drops, and 2 injections.
Which one is the oral?
The rotavirus.
Okay, and that's against intestinal. So let's just go over them briefly. What are the side effects, potential side effects for each of these things?
Okay.
And what would
So,
happen if somebody, what are they? What would happen if somebody got them?
okay. So the two injectable vaccines are completely dead vaccines that have a very, 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 very good. They have, I guess what's most common is for the baby to be a little cranky, and after that to develop a fever, which can last up to 2 days. More children don't react than do react. These vaccines have all been tested together as versus separately. I know one of the things that before I spoke to you, before you invited me, you mentioned this, that you wanted to ask about giving all the vaccines together. So these vaccines have been tested together, and they've shown to have a similar safety profile than when administered separately. Not all vaccines have been tested together, but these particular ones have. The Mechumash has been tested against, has been tested against children getting the vaccines in separate doses.
Okay, so you're saying they work better when they're given together?
So I actually, so let me repeat what I'm saying. So a lot of things that concern is they say, the people say 5 vaccines all in one. That sounds like too much. Can the baby handle all of this all at once? And these 5 have actually been tested. They've undergone clinical trials comparing them to vaccines, the same vaccines being administered separately. And they've come out with the same results, similar side effects, not increased or anything like that.
So it's not that they work better together, but that they're basically the same thing. There's no reason to stick the baby 5 separate times because there's no difference.
It's they're put together as a matter of convenience. As a matter of convenience, basically, yes. As a matter of convenience, they're put together but they have been tested vis-a-vis those separately. There are some vaccines. Now there's another preparation that had a 6-in-1, hepatitis B, added to that also, and that's offered in some countries, but we're no longer giving it in Israel. And that one did show occasional, in certain circumstances, increased side effects. And many countries offer it anyway, provide it anyway. In the U.S. and some they're still offering it in some European countries. In Israel, we don't offer it. I don't know if that was the reason why. They didn't inform me of the decision why they took it out of the schedule. I don't know. I don't know. So I don't know for sure what was the reason why. If that was the reason for another reason. But
what type of side effects?
It's not being given.
What type of side effects are we talking about?
Generally, pain at the site, sometimes a little swelling, fever, a general feeling of unwellness for a couple of days. That's what's most common. Febrile seizures, less common, but they are also known to occur.
Mm-hmm.
They could happen.
With the DPT, and I don't know if this is the same anymore, that they would ask you if the child ran a very high fever to let them know. And I had one kid who got the DT, I guess, after that, like they took out the pertussis or whatever it was, because he had a really, really high fever afterwards. Is that still happening, or is it not anymore?
How old's your kid?
That particular child is 26, so.
Okay. The pertussis vaccine now that they have now has been changed because of a high level of side effects. So it's been changed, and it's less likely to cause side effects, but it's also less effective.
But also the diseases that it's preventing against probably are also less common because for so many years people have been vaccinated.
There was pertussis can also be treated by antibiotics. There was a pertussis outbreak a couple years ago when they were recommending antibiotics for everybody who had contact with someone who had pertussis. So it's not all that uncommon. The vaccine is less effective. The protection is shorter lasting. It goes down after a couple of years, basically. So adults are generally not vaccinated because it's unpleasant disease, but the real danger is for children. So adults aren't getting boosters as a matter of routine. I, as a healthcare provider, was required to get a booster.
Oh, that's interesting. And
Yes.
is it because the disease is more dangerous for children, or just because they goop on each other and they share germs all the time?
Both. They're more likely to catch it, and the disease is more dangerous for them. You know, the little children, their lungs are so small, so you know, they have a more difficulty dealing with respiratory diseases.
Understood. Okay. So at 2 months of age, though, the baby's getting this package with the 5, but also
Yes,
you mentioned 2
the
other things.
pneumococcal vaccine.
Okay. So what's going on with those?
Okay, the pneumococcal vaccine is a very similar profile to the 5-in-1. As of yet, it doesn't come mixed together with anything. It's given in a singular injection. I
If they're
actually,
giving it at
I'm
the
trying
same
not to give
time,
recommendations. I'm trying to give only information and not recommendations.
right?
But this one, I really do strongly give the recommendation to give them together, because it really doesn't increase the severity of side effects. But if you give them separately, they might react twice. So why go through that?
Okay.
So this is the
If
one thing I
it's
think I have a very clear preference, yes, to give them together.
if it's being given together, though, why don't they just put it in with the 5-in-1?
Okay, because maybe someone will try to do that one day. It's as of now, it's a shorter time on the market and it's still patented. So no, so they can't try. Only the same company can try. But when vaccines are mixed together, sometimes they affect each other, and they're either less effective, more effective, cause more side effects. So even the very act of mixing the vaccines can change the property of the vaccines. So it would have to go through many clinical trials before it would go out to the market.
Even though giving it at the same time.
Yes, yes, it's the act of
But it's
mixing the
different.
vaccines.
Okay.
And maybe if I understand, I didn't, maybe if I only have very basic chemistry, we're only required basic chemistry for nursing. Maybe if I knew a little bit more chemistry, I could explain it better. I don't really understand it myself, but
No.
the very act of mixing them changes them. Mixing them
Okay.
with something else changes them.
You are
Yes.
definitely offering a lot more information than even I had up until now. So this is great. We don't have to, if we really need to, we could have, like, some chemist and beg him to come on the show. But I think we're getting a great level
I
of
get along
information.
without understanding how. So I'm guessing it's probably not going to be of great interest to the viewers.
Yeah, that would probably be over the top. But I am just trying to understand. Basically, the downside of separating it is that the 5-in-1 and this particular vaccine have the same side effects. So you might
Mhm.
as well just get it over with, so your baby's not
Yes,
sick
exactly.
another few days.
Yes, exactly.
Okay.
That basically, yes, yes.
Okay. And what would happen, Chas v'shalom, if somebody had that disease? What kind of a disease is that?
The pneumococcal vaccine, it's as it sounds, it's predominantly pneumonia, but it can also involve the ears, the brain, and the brain.
Okay.
And pneumonia itself can be very dangerous for children because, as I said, their lungs are very small.
I
So,
actually remember I was probably not more than 2.5, but I do remember having pneumonia because it was such a big event when I.
wow,
Yeah,
wow.
yeah. I remember specific things. I remember that word. I remember sort of,
Mhm.
my bedroom, and it was a big deal. It was a big event. I was very sick. So that
Yeah,
makes.
yeah, yeah,
And then
yeah.
you said the one that the drops are given at the same
Okay,
time.
the drops, the rotavirus drops. So the rotavirus drops, and I think is a bit more complex. The rotavirus drops is a live vaccine, and parents have come back to me and told me that their kids had really massive diarrheas and were really feeling unwell after the vaccine. I've had parents come and tell me that.
What is it trying to prevent?
It's rotavirus is a disease that attacks the intestines and causes a very severe vomiting and diarrhea for for a long time. Now, I also know people whose kids have gotten the rotavirus, and they've also been like, oh, I wish I would have vaccinated my kid against the rota.
Mm-hmm.
So at the same time, I have parents who've told me that their kids had severe side effects, not as severe as the disease itself, but severe side effects to the vaccine. And then I have parents who have told me who didn't vaccinate, whose kids got the disease and told me that the disease was horrible and they wish they would have vaccinated.
So this is a
So
disease
it's a
that
little more
is
complex.
alive. Yeah, but this is a
Yes.
disease that's alive and common today, as opposed to, say,
Very, very
polio.
common, extremely
Very-
common.
This is not Shigella, though. This is something else?
No, no, that's something else. I'm not aware of any vaccine against Shigella.
No, I don't think so.
Yeah.
Okay.
So
So
yeah, this is
is-
extremely, extremely common. It's extremely common. Actually, it's also only considered dangerous to kids under 2 years old, because by the time they say a child is 5 years old, almost every kid has been exposed to it. But we're adults who've been exposed to it so many times that we're totally immune just from a repeated exposure.
So if, for example, somebody is keeping their child at home, they're not going out to Ma'on, and
Yes.
they may choose then, and they're not maybe, playing in public gymborees or whatever, maybe if that's their lifestyle, their child, it seems like from what you're saying, has a less chance of being exposed to this particular
Yes,
virus.
definitely. Yes, 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 yes. Well, if they're with them most of the time, then then they better be really careful about their own hygiene.
But
A child who's not playing a lot with other children and going in these places would be less at risk. Yes.
okay. And then by the time they're getting to be 2 to 5 years old, their body's strong enough that they can handle a really bad case of diarrhea or something if it would come. They're not as delicate,
Yeah.
you're saying.
Yes. 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 It's also the size. A small sized child loses a certain amount of fluids. It can be very dangerous to an adult losing the same amount of fluid.
Right, right. If a very
The
small child is
the
growing
size.
up and dehydrating very quickly.
Am I allowed to say size counts?
Sure, we can say anything on Geula Mamas.
Okay, so the yes, so that's the rotavirus is only given until 3 months and a week because it was discovered that if it's given too late, there's an increased chance for complications, actually damage to the intestine.
Oh, so it has
So
to be given early.
it has to be given early on. It has
Excuse
to
me.
be given early on. So it's funny that people say that when they're older they can handle it more. Actually, it was discovered that it's an increased chance of complications for giving it later, damaging the intestine if it's given later than earlier. So we only give it to like 3 months and 1 week. And after that, if you miss it, you miss it.
Very interesting.
Yes.
Okay. So now we have newborn, 1 month, 2 months. What's next?
Okay. So at 4 months, second dose of what we got at 2 months. All the same thing.
That's
Yes.
easy. All right.
Yes.
And including the rotavirus because they
Yes.
did it the first time.
Yes. Yes. Yes.
With no side effects.
Yeah.
No increased side effects to the stomach line.
With the rotavirus, subsequent doses are much less likely to produce side effects to the first one.
Okay. Great. What happens after 4 months?
Okay, 6 months, we get repeat doses of hepatitis B, rota, and the mechumash.
Okay. So
In the
not
U.S., they also give the pneumococcal vaccine, but we in Israel only give 3 doses instead of 4 doses, unless there's a child has a specific medical condition making them at increased risk.
like a delicate immune system or something like that?
Yes, yes, yes. Yeah.
Okay. What happens after 6 months?
At 6 months, okay, well, I think I should go back and say
that was 6 months.
Yeah, that was 6 months. And that's when we give the oral polio because we're with the 3rd dose of the mechumash. So that's when we give the oral polio.
Okay, great.
I want to go back and say something because you brought up children with an immune problem. Immunocompromised children don't get live vaccines.
Okay.
So they won't be getting the polio and they won't be getting the rota.
Okay, that is interesting. So they are relying on the, as you said, like the herd immunization, but it's a very specific situation.
Children with diseases of their immune system, cancer, certain types of heart problems, certain types of various conditions. And if your kid is one of them, you already know about that, believe me. Though you will have already been told by your doctor not to get these vaccines.
Okay. So what happens now at post 6 months? What's the next thing happening?
Okay, so the next vaccines are at 1 year, And that's when we give booster doses of the mechumash and the pneumococcal vaccine. And that's when we get the measles, mumps, rubella, varicella vaccine.
Okay. Varicella's chickenpox?
Yes, yes, yes.
Okay. So that was added. That was known as the MMR. So now it's got the chickenpox also. And you can't, I think you can separate it. Can't you say I want the MMR without the chickenpox?
Yes, you can. For the time being, I believe we're heading towards a day when the manufacturer will stop making it. For the time being, yes, you can. They used to give measles, mumps, rubella separately, and then the manufacturer stopped making them because they weren't making money on them because everyone was getting it mixed together. So now you have no choice but to get it mixed together.
Right. I gave my kids the MMR, and then I would do what you call a chickenpox party, which is probably going out of style. But if a kid in town would have chickenpox, you bring your baby over to play in the hope that they'll get chickenpox and get that over with.
Yeah, yeah. I can understand that because, at the time it wasn't sure how long immunity would last and if it might fade away. And then therefore, if somebody got the disease itself, they would be actually better protected than someone who got the vaccine in their later years. But it really seems as if the vaccine, like, how long has it been on the market? More than 10 years, but less than 20, I think. I don't remember exactly.
That makes sense, yeah.
Yeah. It seems as if it's now the first dose actually, was not very effective, but after 2 doses, it seems like it's going to have very long-lasting effects.
It also, right, that was definitely one of the concerns. Isn't there also something to be said, though, for a person being exposed to an illness, their body just going through that whole process of fighting off an illness or healing through it, just in general for our body's immune system? Isn't there something, what I've heard, just to be said for going through that natural process?
Okay, well, they said whatever doesn't kill you makes you stronger. But what about those people who will end up getting complications? It's much,
Right. So with
So
chickenpox, for sure, with the measles, mumps, and rubella, I mean, those are really serious diseases. You could sort of, they're similar family diseases, right?
Yeah.
But with chickenpox, from what I personally had understood, it was the complications were so rare. For older people, they're very serious, right? But in childhood,
yeah. So,
okay.
yeah.
Well, also with children, with less children getting chickenpox, it also helps the older population not to be exposed if their immunity has worn off.
Yes. But I think also that was one of the reasons why I felt it was actually more important to get my kids vaccinated when they were young, because I had them when I was 6. I don't think I even have a scratch. Some people do get scars. Some people do get scars from the chickenpox, and that can affect people's self-esteem, which is also something to be, even though it's not a deadly, terrifying side effect. I didn't get not a scar, not anything. I don't even think I was very sick at all. But as now that more people are getting vaccinated, I think it's actually more important to get vaccinated because your kid may be exposed to it at a later age and not get it when they're young. That's what you were saying about the chickenpox party.
It is, because if they have nowhere, if you can't do that chickenpox party, if they have nowhere to be exposed to, it can be really dangerous. I remember a family whose grandparents had never had chickenpox, and that's really, really dangerous when one of the kids did. So if you don't know anyone having chickenpox, your kids could become teenagers, and teenagers could get really, really sick. I mean, that's very dangerous, right?
Yeah.
Does it also, though, prevent against, what is that? Why am I forgetting?
Shingles.
Shingles, thank you.
Shingles.
How does that happen?
Okay, we believe so. We believe it does in cases of adult, and I don't know the mechanism behind it. I don't know if there have been enough people who have reached the age when shingles is common to be able to make a full statistics, but we can see enough of a decrease that yes. Yeah.
Okay. So it seems like getting
it seems that it does protect against shingles. Yes.
That the immunization itself, or just having less chickenpox floating around? Because it used to be everybody got chickenpox, right? Now it's very rare. So one of those may be
The immunization itself.
Okay. So are older
The
people
immunization itself.
immunized? In other words, like I was never immunized against chickenpox. I mean, I had them naturally, but if somebody is elderly, are they getting immunized now with the chickenpox vaccine?
There is what's called a shingles vaccine, and it's given to the elderly. I'm not very familiar with it. It's not the population that I work with, so
Okay,
unfortunately.
no, that's good. I didn't know there was. Okay, okay.
Yeah, I don't really know about that. You and I, who had natural chickenpox, are more at risk of developing shingles when we're old. So it seems that the virus never totally leaves the body, and it just hides out in the nervous system, and one day when the person is old, says, "Hi, here I am," and causes them a lot of pain.
Got it.
So I guess the chickenpox vaccine, which is a live vaccine, there's a possibility that it could do the same thing, but the possibility is much, much lower than the virus itself, the wild virus itself.
Okay, great. So now we're at 1 year of age, right?
Yes.
What's the
There's
next?
one more thing. I gave my kids the MMRV mixed together. I gave them all mixed in one vaccine because I don't want to, why give them another injection?
Right, if you're giving it.
But
Yeah, if you're
yeah,
giving it, why not?
because this is one of the vaccines that when you mix them together, the act of mixing, for whatever reason, causes increased side effects. If you give the 2 injections at the same time, even if you give them one on one side and one on the other side on the same day, it doesn't cause increased side effects, but the act of mixing, for whatever reason, does. It changes the vaccine.
So why did you make the decision to give that mix then?
Okay, well, the first time is because I didn't know. When I first went there, it was before I started working, and I didn't know, and the nurse didn't tell me, didn't offer it to me. Sometimes they don't have it in stock, so
Right.
sometimes it's not an option. The second time, I decided to take my chances because my kids reacted generally very well to vaccines and had very mild, if any, side effects. So I just decided to go with it.
And that worked out
And they
for
didn't.
you then.
And the truth is, yeah, and they didn't react.
So that is important to know your child.
Yes.
Because you're right, some
Yes.
of my children sailed through immunizations fine. And I remember one of my kids would get fever and be sick with each and every vaccination. So it definitely would make a difference.
Yes, yes, yes.
Okay.
And it's sometimes the nurse in the clinic may not tell you that, maybe because they're not offering it, they don't have it in stock, or they may not mention that to you. Like no one mentioned it to me when I went to, and I have to admit the truth, I don't always mention it either. If parents ask me about splitting the vaccines, decreasing side effects, then I will give them that information. But if they don't ask me, I generally also don't offer that information on my own. Maybe I should.
Right. That makes, and it's not. I mean, one of my kids, I remember they said it wasn't available and I would have to come back another time if I wanted that. I mean, it's not standard at all.
Yeah.
So what happens after 1 year of age? What's the next step?
Okay. So right now on the Ministry of Health, what's left is the second dose of polio, of oral polio, and 2 doses of hepatitis A vaccine.
That's new. We haven't talked about that.
Right. It's a different kind of hepatitis. It's a different kind of hepatitis A than the first. Most cases are less severe.
When
even
you
though
hear about someone getting hepatitis and their skin is yellow, the standard hepatitis, that's A, right?
When you hear about somebody getting hepatitis, it's usually hepatitis B. It's usually hepatitis A, excuse me. The one that we get when the kid is a bit older.
Right.
So babies actually usually have very mild cases of the disease. So, so we can wait a year and give it to them. We don't know how long protection lasts for. Hopefully it's lifelong, but we don't know that yet. Because the older you get, actually, the more likely you are to have a severe case of the disease. On that one. Yeah. Yeah.
So when are they giving the 2 doses of A?
A year and a half and 2. Yeah.
At 2, the kid the child is considered fully immunized, right?
Fully immunized according to the current schedule of the health ministry. I am lobbying them for them to move the second measles vaccine earlier, but that hasn't been done yet. I have a lot of complaints at the Ministry of Health. I think they're partly to blame for the measles outbreak, and they're pointing fingers at everyone but themselves. But I think in the United States, the second measles vaccine is given at age 4. In some European countries, it's given at age 2. Why are we waiting until age 6, which is the latest recommended age?
Oh, so that's the one they're giving in first grade is the second measles.
Yes. And the reason might be, I don't know, is because it does have a less of a chance of causing side effects with older kid, fever, and especially febrile seizures. The older the kid is, the less likely they are to get those side effects. So there is some benefit to delaying them, but why not at 4? Why wait till 6? I think a lot of cases of measles that happened during the exam could have been prevented. I know of some children who were infected, who had already had 1 dose, and some people who were exposed to people who were, and who knows who they may have infected.
Right. Oh, that's very
So
interesting.
So I am.
No, I'm sorry. Go on.
And I'm saying, so stay tuned. Stay tuned. It's in the works that the measles vaccine may be moved up earlier. That's all.
So by waiting until 4, then they're old enough to prevent many of the side effects.
Yes.
Young enough so that that at 4 years old that it's still.
Yes.
Very interesting. Okay.
That they'll go into GON fully immunized.
Right. So in first grade in Israel, they're giving right now the measles, mumps, rubella, and whatever you said.
Varicella, chickenpox.
Anything else in first grade?
First grade, they're giving booster doses of the tetanus diphtheria. Booster dose.
We didn't talk about oh yes, that was in the DPP,
part of the chumash for the kids. Okay. Yeah.
Tetanus seems like, I mean, again, we're not giving judgments here, but tetanus is a real thing, right? If you get cut by something with rust on it or even dirt, right? Like if you tell us more about what tetanus.
So I actually saw a baby that had tetanus. It wasn't in Israel, it wasn't in the US. It was when I was a new graduate and I did a volunteer program in Africa. I saw a baby with tetanus who had been born in a dirt hut. Wasn't a pretty sight. Like the whole baby was like discolored and swollen, and I don't know what happened to that baby afterwards, because it can paralyze their respiratory muscles, and I don't know what happened after it.
Tetanus is not something that we get from somebody else, as opposed to pretty much everything else where we are vaccinating against are diseases passed from person to person. But
animals carry it. Animals are the ones who usually carry it, and therefore it can be in dirt. The animals can shed it in the dirt.
So if a child's playing in sand or dirt or anything, they could.
Yeah, animals can shed it there. It has to go. It goes deep into the blood. Tetanus is what's called an anaerobic. It's anaerobic, meaning it thrives without oxygen, in environments without oxygen. So a deep cut is usually more likely to get the disease. But even if you get a superficial cut, it's best to get the vaccine, I think.
Why was I always told rusty things? What does rust have to do with tetanus?
Because these are old things that have been lying around and more likely to have been contaminated.
So it has nothing to do with the rust itself.
It's not the rust itself. Well, it could be. I have to look this up. Rust could mean more iron, and then therefore more food for the bacteria to grow. But that I'm just speculating off the top of my head. I don't know. I would have to look that up.
And I remember one of my kids got a pretty deep cut, and we were concerned because it was a metal, maybe rusty. It wasn't the house, but because it had bled, like they had bled a lot, the doctor said that it was fine because everything was washed out. Do you agree with that? Do you have an opinion on that?
I don't know. I don't know if that's fine or not. I don't know. I've seen that recommendation made on occasion, but I don't know if it is evidence-based or not. So I don't know what to tell you about that.
Are there any side effects of the tetanus vaccine?
You mean like very, very dangerous side effects?
I'm asking.
I was told about an incident of a woman who developed Guillain-Barré syndrome after a DTaP vaccine. I was recently reading about it. That would be an extremely, extremely, extremely rare occurrence.
So people get vaccinated against tetanus and these other diseases. But if somebody, let's say, is, I don't know, 8 years old or an adult person, and they've gotten some sort of cut or, something dirty, they don't get it by playing in the dirt, you're saying, and not unless they actually inject into their
It will
blood.
go in the blood. If it goes into the bloodstream. Yeah.
Should someone then go and get some sort of booster, or do we rely on the immunization?
If it's been 5 years since their last dose, then a booster is recommended.
Okay. So we don't have a whole lot of time, but let's quickly run through first grade. They're getting the tetanus and the other things and the MMR, right? And also the chicken
Beyond
pox.
first grade, I don't really know. I'm sorry. I'm only working with little kids.
Basically, it seems like it would just be boosters of things they've had. Is there anything new that would be introduced later on? Do you know?
The HPV vaccine, I had it myself. I decided to have it myself, even as adult, even though I was past the recommended age. The human papillomavirus vaccine, that's a virus that's been implicated in cervical cancer. But unfortunately, I don't have a lot of information about that. I have really focused.
Is that given to children? That's
giving
children?
They're giving it to preteens and early teens.
So it has something to do with sexual activity then?
Yes.
And only girls, I'm guessing.
I'm not up to date on that. It was being tested to see it was on boys, but I don't know what the results for that were. But I think it's going to be recommended to boys as well. I don't have so much information about that.
So if somebody personally knows that their child is a virgin, maybe they're in the shidduch system, they're marrying a virgin, they're 100% certain of that, there's very little risk for this particular virus. Is that correct?
Well, when you're a preteen, you don't know what's going to be.
Correct. But I'm just saying, if hypothetically somebody would know. I mean, some people are in situations that they really do know. You have to know your child, you have to know your situation, your datiyut, and that kind of thing. Okay. But that, because it is a sexually transmitted disease, right?
Yes.
Okay. Excellent. All right. Wait, I think I had one more question before we wrap up. It was something I was thinking about. I guess if I can't remember, then it is not meant to be. All right. So we're going to wrap up now. You are not quite ready to launch your personal services yet, right?
No.
You do have some sort of a blog and answering questions. I mean, you're just
I'm launching it, and I'd love to send you the link when I have it set up.
Okay,
so people have further questions.
By the time this show airs, you should be all set up. So we'll put that in the show notes. Okay, marvelous. So we're not going to be giving. What is that blog going to be about?
Healthcare, baby, pregnancy and baby care. It's going to include not health health information, but more so personal opinions. It'll be more about personal opinions about things that are going on in the world of healthcare, in the world of women's health, in the world of baby health. It's going to have some critical opinions and some things like care could be improved, but it'll also be available to provide information for people who are interested.
So people will be able to ask you questions, and at some point you will write a blog post about that. Maybe not personally, but for everyone to understand.
Yes. Yes.
Great.
Yes.
Wow. Well, you have a lot of knowledge and experience, so I think this is going to be an exciting place to get really good information.
Okay.
Thank you.
Okay.
I know
Thank you
what I
so much
wanted.
for inviting me.
I don't know if this is what I wanted to say, but I do want to share what I personally did. Now, I was given this advice, again, we're talking about 20 something years ago. And I'm not saying this is a good idea. I'm just saying this is what I did.
Mm-hmm.
So I was taught that the baby's immune system is not really as active until they're about a year old. So that if baby's home with mommy, not going out to childcare,
Mm-hmm.
not really playing with a whole bunch of other babies, and breastfeeding, so when they're exposed to something, it's passing through to mom,
Mm-hmm.
and the mother can make I guess antibodies that pass it back to the baby. So I was told that stage 1 is to possibly delay immunizations, not the testing, but the immunizations, until the baby's 10 months to a year old. So that is something that I did with a few of my children. Now, I think that my youngest baby may have had, um, I'm trying to remember, she had a red rash on her tummy, and I'm forgetting, is that, which disease is that? Could that be? You know, like a red rash on the tummy, like going around the side?
Not sure.
The fever. I think she may have had a form of one of these diseases, but she was
Mm-hmm.
playing with some other babies, because we would have a mommy and me gathering, and those babies were immunized. So she may have been exposed to something.
Mm-hmm.
She had a pretty high fever. It passed in a couple of days. She was fine.
Mm-hmm.
But it
Great.
definitely was, I think she did have a something, you know. Um, but I did it with a few of my children, and they didn't have a problem. And then when I did start immunizing, I would give not one vaccine, like I wouldn't make them pull apart, like you said, the 5-in-1, but
Mm-hmm.
one dose. So let's say if they got the 5-in-1 that day, and then I would come back 2, 3, 4 months later and get whatever the next one was. And the reasoning that I learned for that was, like we said, these guidelines are set up for everybody.
Mm-hmm.
So most people, especially with a newborn baby, they have a lot of questions. They're going to be coming to the nurse. They're going to be coming to the doctor more often. That is the time to get these vaccines done while they're there. And also, once your baby's 2, 3 years old, the process of getting a shot is much more traumatic for them. And
Yes.
so if you just
Yes.
let people, right, you let people be, you'll have a lot more disease. So
Mm-hmm.
this system that we have is very, very good for the masses. I took it upon myself to bring my child in, to give one shot at a time, to make sure they were always as healthy as could be when I gave that vaccination. But that meant that my kids would be getting vaccinated, especially with these boosters, till 4, 5 years old. And I would have to, talk with them and give them prizes and sit with them. It was a much more difficult process. I had to be very responsible with it.
Mm-hmm.
But that was sort of, I guess, a shiluf, like I wasn't not vaccinating, but I also wasn't vaccinating according to the schedule. For me,
Mm-hmm.
it seemed like a nice personal in between, but it took a lot of responsibility. I
Mm-hmm.
didn't always want to make that appointment. I didn't necessarily want to bring a 3-year-old in that didn't want to get a shot, but I had to do that. So again, that's just another idea thrown out in there. But now I appreciate knowing more about each of the vaccinations. If I were to do it again, I may
Mm-hmm.
make a decision to give one of them earlier. Like, for example, I think you said the rotavirus, was that called?
Yes.
That you
Yes.
want to give before the 3 months and 1 week.
Yes.
If I
Well,
chose to give
if
that
you
one,
come too late, we won't give it to you.
right.
It's against,
But
the
I could,
guidelines say up until this point. Yeah.
with that information now, I can decide what is the risk of them getting the disease. Do I
Mm-hmm.
want to do this? What age? I know a lot more about each vaccination now, and also how they've changed, because the information somebody has at one point is not necessarily what it is, a year or even 6 months later. So up-to-date information is really good. I know my question. I remember it.
Mm-hmm.
Which I think I know, but which of these immunizations is associated with the possible risk of autism?
That is the measles vaccine, and I can tell you about the story about that. So the measles vaccine, there was I think in the 1970s, a study came out showing a connection between autism and the measles vaccine. Studies afterwards, multiple studies afterwards, have failed to replicate the connection, and it was discovered that the study was being funded by a malpractice lawyers organization that were funding the study, as well as that some of the study participants already had signs of autism when they were enrolled in the study.
Because it's such a known thing. You know, the vaccinations cause, you just know it. But you're saying that it's really doesn't seem to be.
Yeah.
That's
right. So the two issues were that some of the participants already had signs of autism. Nowadays, we diagnose autism much earlier, and we can usually find that the symptoms were present before the vaccine.
I think also personally, I have a son with autism, and autism is such a broad word. You know, my son is very, very similar to other family members who managed to deal with their symptoms. But now we know from age 2.5, it's called autism. But if I ask other family members, you can see today, you can also ask another child, it's the same demut, it's the same type of person. However, I did have a friend whose child was progressing normally. They were speaking and everything. And she says that it happened post one of his vaccinations. I don't even know which. And he was completely nonverbal at some point after that. So I'm thinking maybe, I don't know if it was the immunization. I don't know if it was, I think maybe he had a high fever, maybe even had seizures or something after that. I don't really know the story well enough, but it seemed like that was it. To lump that child with my child and call them both autism, I just don't think it's the same thing at all.
Okay. Yeah, so it's very, very broad. And I think at that time, I don't know what the definitions they were using for diagnostic definitions they were using for autism at the time that study was done. I could tell you the theory regarding why it might cause autism is that it is a live vaccine and the virus can go to the brain. And that is theoretically a possibility. And there are known cases where that has occurred. Extremely, extremely rare. I believe less than 1 in 100,000, where the virus has the vaccine virus has gone to the brain and affected the brain, and but still taking thousands and thousands of children, there have been no and measuring children who have had the vaccine, children who haven't had the vaccine. And there's not an increase in the children who have had the vaccine. It's even been studied with siblings of children with autism who are more likely to develop autism themselves. And amongst the siblings studied, siblings who had the vaccine and siblings who didn't have the vaccine, there was no difference in which ones of them were diagnosed with autism. As you said, the diagnosis of autism is also a sticky question. What diagnostic criteria? But whatever diagnostic criteria were used, they were the same for both groups, and there was no difference between any groups. So I really don't think autism is something to worry about.
Okay, because I think that is something that we all do worry about.
I mean, because of the vaccine.
Right, because it's the hype, it's what you hear.
Yeah. Yeah, I don't think it's based on. I don't think it's based on true concerns and on accurate information is what I'm trying to say. Obviously, we could all not all cases of autism. As you said, some cases of autism are regression cases. The kid starts developing normally and then regresses. Not all of them show symptoms early on. That's true, as you said. But there weren't more of those in the vaccinated group vis-a-vis the unvaccinated. I understand the theoretical concern. The theoretical concern is a true concern about a virus going to the person's brain. That is a true concern. But what you can say also is that if you were worried about the theoretical virus going to the brain from disease, you should be a lot more worried about the actual measles virus going to the brain.
Right, because you're talking about the measles, mumps, rubella, and possibly chickenpox. The side effects
right.
of those diseases are very serious.
Yeah. So I'm saying is, if the concern is that because it's a live vaccine, so the virus can affect the brain, then there's a much greater concern about the full-fledged disease itself.
Is it helped? You mentioned that the reason that particular vaccine is given later is because there's a reduction in side effects, and that you don't agree it should be given.
Fever and febrile seizures.
Okay, so that has nothing to do with this side effect, just the seizures.
Right. Yeah.
Okay. All right.
Yes.
Now it's time to give stuff away. So we don't have.
I have one more thing to add.
Oh,
I
yes.
appreciate that you started your program without shaming, and I think and I really support that. And I never try to shame people into making the decisions that I think that they should make. And I see a lot of parents who are so anxious. Should I give this vaccine or shouldn't I give this vaccine? And I just want to put in perspective of the larger scope of parenting, and that is vaccines is just one of the many decisions that we have to make about so many things. And whatever it is, just chill, just be cool.
I am so
decide about, and if we agonize over all of them, then we'll just never stop agonizing.
I mean, and we're also to appreciate the fact that we can agonize over this, because in the past, your kid was going to get sick. People died. People just died from childhood illness regularly, right?
Yes.
Nobody had this choice. You know, it's kind of like, are you going to send to a Montessori preschool, or are you going to homeschool? You're going to send to school, you're going to send to gun. It's just like the other decisions that we make. It's not
exactly.
It's not clear what's right or wrong.
It's well, I think there is, but if you don't, you're
Exactly right. Everyone can have their opinion. Look, some people say, and like you said, any decision. Some people will say that giving your child a lollipop is absolute poison. They can prove it to you. The other person says it's the best thing you can ever do. Each of them has proof. That's it.
Yes.
Right?
Yes.
Yeah. I think it's so important.
Well, I have to say, I think the proof on the side of most vaccines is stronger than the proof against.
That is, again, your personal, right. That's your personal situation. And hopefully with all the information that you shared today, parents will have more information at their fingertips to even make that decision, because Google searching it's huge. I mean, and any article you're reading is generally quite biased. And you've given us a lot of information, and I could tell that you were really trying to keep any bias out of that.
I'm trying very hard. I have my own preferences, as you know, but I am trying. I'm trying very hard. So I hope,
It came through. It came through. I really appreciate it, and I know that the mamas here are going to appreciate it, because it's really valuable information. Really, really valuable. It's great. And especially as women, and especially as Neshei Yisrael, women of Am Yisrael, to stand together and to support each other. And obviously somebody can choose, if a child is vaccinated or not vaccinated. You can have them play together, you can not have them play together. We can make that sort of information without it meaning anything, just because of general, health and safety. Just like you don't, whatever, have your kid, touching the other one's dirty diaper. That's just a general health concern that people didn't know about 200 years ago. I mean, doctors would go from the morgue to delivering babies. They didn't know about the transfer of germs. There are things that we know about today, and we can just, take our normal precautions without any judgment, and just support each other in that. So, all right. So the lovely, lovely ladies that are on our Geula Mamas Facebook group, there are 3 ways you can listen to this show, right? You can go to the Facebook group, you can get the link, which anyways leads you to YouTube. Somebody can be listening on YouTube right now that can be watching the live taping of this show. You can also go to any podcast provider and search for Geula Mamas, and you can listen as an audio, which I like to do that because I can walk, I can wash my dishes, I can do things while I'm listening. So unless it's an actual visual show, that is my personal preferred method. But the reason that I have the Geula Mamas Facebook group is that so that we can have discussion, right? We can talk, again, in a positive way. We can ask questions, we can get answers, we can support each other. So I do encourage you, if you are coming through Facebook or I'm coming through YouTube or the podcast, to hop over and join the Facebook group so that we can have more discussion over there. So the members of the Facebook group are eligible to win a Geula Mamas magnet. So this magnet is going back to the amazing episode we have with Susie Benziken. She was teaching about reflexology. She's a master reflexologist. It was really amazing. And she wanted to encourage us to listen to her inner voice, which, oh my goodness, reminds me that I didn't even ask Sara the most important question. How do I know that she said that? Okay, wait, rewind, stop, rewind. Sara, if you would do me a favor and just like close your eyes and breathe deeply, because I have the all important question for you. You personally, with your life experience and your wisdom and everything that you bring into the world, the most amazing bits of you that you are here in the world with, if you were like standing at Har Sinai in front of all the women of Am Yisrael that were ever born, that would ever be born, you have one thing to say to all of these amazing women. What is just the first thing that bubbles up from you personally? What is your message to the women of Am Yisrael? There's no wrong answer here.
Love yourself, love your children, love the people around you. Don't let anybody keep you down or shame you, as you mentioned. Just do the best you can.
Okay, so love yourself, love your children. Help me with this one. And don't let anyone shame you. Don't let anyone get you down. You're amazing, and just keep doing the best you can.
Do the best you can. You just have to know that you're doing the best you can. I mean, it's very cheesy. What would I used to hear this on this? I'm opening my eyes again. You know, there's a children's record that plays in my mind. Do your best to pass the test and let Hashem take care of the rest.
I love that, though. You know, I think some of those things that are cheesy, we need to hear them over and over because they're so wise and they're so important. And I have one of my kids who really, really struggles with tests. She gets really nervous, and we're still figuring out if she has dyslexia or something. She definitely has a challenge when it comes to tests and reading. And I said, you know, the teacher will say, oh, you must get this mark, you know, because she's trying to get the whole class in general to do well, to take it seriously. But this child already takes everything so seriously. So it doesn't help when the teacher, you know, puts the pressure on, and she just can't. Yeah. And so I've been saying that type of thing to her. You just do your best. And your best does not mean that she is not allowed to play and she's not allowed to read and she just has to study all the time. Because that's sort of where we were going, right? And it reminds me, as a mother, you know, am I going to just push? No, we need self-care. We need to tell ourselves, pat on the back, give myself a hug. I'm doing the best I can, and let Hashem take care of the rest. Mm-hmm. So
what you're describing reminds me of one of my kids toileting, but I guess that's a discussion for another day.
Oh, goodness. Yes. Potty training. That's so fun. All right. So Susie Benziken said you should listen to your inner voice. Absolutely. I'm so, the inner voice, it's also like very quiet, and it's so personal, and it whispers to you, and it's so polite. It's like the outside world bangs on your head, you know, the inner voice is like this nice quiet voice. So listen to it and go with yourself. And this is going to Sarah Erlinger. I always apologize for saying your last names wrong. They're very difficult. Yay, Sara Erlinger, you just won that magnet. And this is a Geula Mamas affirmation. I am so precious. Hashem loves me more than I can ever imagine. That is going to Yona Goldman. Yay! So you have been listening to the Geula Mamas show. If you enjoyed this show or any of our other shows, please be a friend, share it with someone who might benefit from this information. And I want you to have a great day. And remember that Hashem loves you and I love you. Goodbye.